Welcome to your week-by-week pregnancy video series, brought to you by Ultrasound Dimensions, Medical and Maternity Ultrasound Centre.
Welcome to PregnancyChat.com and week 34 of your pregnancy. I'm Monica Healy. Let's start by chatting about what is happening with baby this week. Your baby is weighing in at around 2.3 kilos or around 5 pounds and is about 18 inches or 45 centimeters from head to toe and about the size of a large butternut squash. This is day 232 of your pregnancy, and that means only 48 more days to go. Your baby continues to make all sorts of facial expressions in the womb with lots of smiling and yawning. Interestingly, you won't see baby smile after birth until baby is about 4 to 6 weeks old. While hair on your baby's head continues to thicken, he is still shedding most of the soft body hair called lanugo. That waxy-like substance we have talked about before called vernix still covers and protects baby's skin. After birth, you may see traces of vernix, especially under baby's arms, behind the ears, and in the groin area. Baby's skin is becoming significantly less wrinkled. His tiny little fingernails have reached the tips of the fingers and may have to be clipped after birth to prevent baby from scratching him or herself. Your little one's own immune system can fight mild infections now. Your baby's lungs are maturing, but they still need a little more time to develop. At this stage, your baby's adrenal glands are producing 10 times more steroid hormone than a normal adult. These hormones indirectly stimulate lactation in you, the mother. Lactation is when the breasts secrete milk for the baby. The baby's adrenal glands will shrink to a normal size after birth. The bones of his skeletal system still continue to harden, so it's very important for you to continue taking calcium. If you're not providing enough calcium, your baby will draw calcium from your bones to ensure that he is receiving his necessary minerals. This can greatly weaken your own bones and teeth, so be sure you are eating or supplementing enough calcium in your diet. There are still some new developments in your fetus. If you're having a baby boy, then his testes have probably made their final descent into the scrotum, unless he falls into that 3 to 4% of boys who are born with testes that have yet to drop. This may not be common, but it is nothing to fear. They usually make their way down by his first birthday. Space for baby is becoming more restricted, so movements may be fewer but much more powerful when they do happen. So what's happening with you this week? Those pesky symptoms continue to affect you as you endure heightened fatigue this week. Perhaps you're not as drained as the first trimester, but lack of sleep combined with physical exertion create a tired mommy-to-be. Constipation and hemorrhoids may be plaguing you as well. Fight back with a high-fiber diet. If you were not having leaky breasts before, you may experience it this week. Some women never leak colostrum. It does not mean that their bodies are not prepared for their baby's arrival. The Braxton Hicks contractions may have become more frequent in preparation for real labor. Braxton Hicks feel like a tightening at the top of the uterus that spreads down and then relaxes. Please note that Braxton Hicks feel quite different from real contractions. Real labor contractions will become more frequent, progressively longer in duration, and much more painful. If your water breaks, please call your doctor immediately. Your weight gain will be around a pound per week, and you'll be surprised how big your tummy is now getting. With all that weight you're carrying around, you'll need to slow down. Try not to exert yourself and avoid doing any unnecessary projects. As I already mentioned, insomnia can remain a problem, so try developing a winding down routine before bedtime. Try a nice warm bath with some lavender drops. Listen to soothing music and have a nice warm cup of milk to make you sleepy. Use pillows to make yourself comfortable in bed. Continue to use womb music. Baby can hear clearly from about week 20, and it has been stated in studies that babies will remember music that they heard while in the womb. This can soothe and upset a baby after birth. Your baby can be receptive to your mood too, so play music that you like as well. Another symptom you may be experiencing is abdominal stretching and areas of heat on your abdomen. This uncomfortable burning sensation across your stretched belly is caused by the pressure the uterus or womb is putting on the abdominal muscles. This pain sensation would be near the surface of your abdomen, so if you experience pain deep within your abdomen, please speak to your doctor or midwife. You can also consider wearing looser fitting clothes, as tighter garments can cause more pressure and irritation. These are my tips for this week. If you haven't signed up for childbirth classes, now is the time. By now you will probably have left work or are thinking of leaving soon. Sit down and figure out how your maternity leave may affect your financial life. Have you decided whether you want to breastfeed or not? See our quick breastfeeding video for more info. You will likely be visiting your doctor weekly now, where blood pressure and urine tests will be carried out for any signs of trouble such as high blood pressure or protein in your urine. Get all final preparations underway so that should baby come early, you are completely prepared. You may want to consider some of the following. Give a trusted family member or friend the keys to your house. Contact someone to feed pets, water plants, and pick up your mail. If you have children, make sure arrangements for people to take them to school and other activities. If necessary, recruit someone to fill in where needed at work or other obligations. So that's it for week 34. If you have any questions or comments, please join in the conversation in our forums at pregnancychat.com. I can't wait to tell you what is happening during week 35. Until then, enjoy this pregnancy journey. These are the precious moments our lives are made of. I'm Monica Healy, and thanks for watching.
Thank you for watching. If you're looking for a medical or maternity ultrasound scan, we can help. Since 2007, Ultrasound Dimensions has been trusted by over 31,000 patients and doctors. Our Enterprise Ireland award-winning team offers you convenient appointments, immediate results, and always takes the time to give you peace of mind. To schedule your appointment, contact us today.